Hi everyone, welcome back to my channel. So my ongoing efforts to get healthier, especially in my postpartum period, I wanted to focus this video on talking about topics you can discuss with your primary care provider doing an annual exam or checkup. In my opinion, medical professionals are often the worst patients, and I think I definitely fall into that category. For instance, I technically have not been to my internist or family physician since 2008. I can't believe that much time has passed. It's kind of ridiculous, but for whatever reason, I just never went back. I generally feel healthy. I feel like I got a lot on my plate already, that it's hard to actually make another appointment. I think these are all the excuses that I told myself in terms of why I didn't need to go for my annual checkup. In addition, of course, I was seeing my obstetrician because I have had 4 babies in the meantime. So I did get some type of primary care, in my opinion. I was having my blood pressure checked. I did get exams. However, obstetricians don't focus on your overall general health adequately enough. So it's really important for all women, men included, to go for annual checkups. So this week, I actually finally did make an appointment to return to my family physician or my primary care physician for my annual checkup. And I wanted to share with you some tips she gave me in terms of how to get healthier, and also give you some suggestions for topics of discussion that you should have with your primary care providers as well. If you like these kind of videos, please let me know by giving this video a thumbs up and subscribing to my channel. I'd really appreciate it. So I wanted to focus on a few major areas of discussion that should be brought up with your primary care provider. First of all, as a general overview, what usually happens in these visits is your physician will go through your medical history and update anything that's happened since you've last been there. In addition to going through a detailed family history, which can be very important in terms of determining risk factors for certain diseases and cancers. And finally, you should have a good examination, including vital signs and a thorough full body examination. That being said, I really wanted to focus this video on topics to discuss with your primary care provider and focusing it on somebody in their 30s to 40s. I'm currently 39 years old, so I'm really in that age category. Of course, if you're younger or older than this age range, the recommended topics for discussion may change slightly. So February is American Heart Month, and the focus of this month is really to encourage people to think about heart health and minimizing their risk factors for heart disease. People are often surprised to hear that the #1 killer for men and women in the country is really heart disease. The second one is cancer, which I'll focus on in the next point. But the #1 cause for mortality for women of all ages is heart disease. So it's really important, even in your 30s and 40s, to focus on minimizing your risk factors. So part of the risk factors, of course, are genetic, and you can't do a whole lot about that. However, some of the risk factors you can modify. So part of your primary care visit should be to discuss things such as blood pressure lowering your heart rate, checking your lipid panel, your cholesterol panel, and if any of those are elevated, you should discuss with your provider as to how you can improve on those. In general, the answer will be to improve your diet and exercise. So eating a healthy, balanced diet, as you all know, is really recommended for any age you are. In terms of exercise, I had some specific recommendations from my provider that I did want to share with you all. Even though I'm pretty active and busy on my feet, both through my job and also running after 4 little kids, what I really need to do is get true aerobic, intense exercise, and that I'm just not doing. So one thing I recommended in a previous video was to consider getting a Fitbit. That's definitely a motivator for me. I'm a pretty competitive person, so I like seeing how many steps I take per day. And if I'm not meeting the adequate step count, I tend to increase my exercise. So it's definitely been a motivating tool for me. So when we talk about aerobic exercise, what that specifically means is you're recommended to increase your heart rate at least greater than 120 beats per minute for at least 20 minutes for 4 times a week. So in order to accomplish this, there are some great references here on YouTube and videos to watch that are exactly 15 to 20 minutes and include this level of aerobic exercise. She provided me with several websites here on YouTube to check out, and I will link those down below for you as well. I did discuss with her whether or not I should join a gym, and she thought that just probably wouldn't work for my lifestyle. The reason is, it's just hard to get yourself to get motivated enough to leave the house and actually go to the gym to work out. The startup cost, in a sense, is just too high, especially with a busy lifestyle with young kids. So she recommended just staying at home, doing these quick 15 or 20 minute videos at least 4 times a week, hopefully daily at some point. Another fun thing that I'm going to try is doing these videos with my children. I think they'll really get a kick out of it and really will get into it as well. The videos are really fun, upbeat, often have a lot of fun music associated with them, so something I'm really excited to try. I have done step classes before and really enjoyed them as well, so I'm going to give them a shot and let you know how they work out. But definitely go ahead and check them out for yourself down below. So the second most significant cause of mortality here in the United States for women is cancer. And as an oncologist, of course, this is something that I think about on a daily basis. And there are several screening guidelines that we definitely still recommend that people follow. Of course, over the past several years, some of these guidelines have become somewhat controversial. However, I'll just give you my take on it and the recommendations I received from my physician. But I suggest you actually discuss these in more detail with your physician as well. So for somebody in their 30s to 40s, there are a couple of cancer screening things to think about. So the first is the pap smear. So depending on whether you have a pap test alone or the human papilloma virus testing as well, the recommended guidelines for pap testing in the United States and for women in their 30s to 40s is to have this performed every 3 to 5 years, provided that your pap smears have been normal and you don't have any significant high risk factors. When you're pregnant and even in the immediate postpartum period, your obstetrician often will perform a pap smear regardless. So I just had one a month ago, so I'm definitely up to date. But in general, every 3 to 5 years, the pap test should be performed. The second area of cancer screening to think about for women in their 30s to 40s is whether or not you should have breast cancer screening. So provided you have no significant high risk factors, somebody less than 40 generally is not recommended to start mammogram screening. However, a good annual breast exam by your physician can never hurt. For people over 40, this is where the controversy lies. So some references will suggest to start mammogram screening for a patient of average risk over 40 years old, but it's something to discuss with your physician. The third area of cancer screening to think about is skin cancers, and this area is often overlooked. Again, I grew up in Hawaii and had a lot of sun exposure as a little kid and didn't use sunscreen as regularly as I should have. So skin cancer risk is something that I'm very conscious of. So it's good to do self-skin exams, and if you notice any irregular mole that starts changing, it's something to bring up to your provider. In general, if a mole is less than the size of a pencil eraser, it usually is not of huge concern unless it looks irregular. If it starts growing larger than that or looks irregular, please bring it up with your provider. But a good skin cancer screen by your primary care provider is something that's recommended during this age. The third area to talk about with your provider is whether or not you need vaccinations. So working in the healthcare industry, of course, I'm up to date on all my vaccines, including tuberculosis screening. So discuss what's needed for you based on your lifestyle with your physician. The only vaccine I needed this week when I visited my primary care provider was the hepatitis A vaccination. This vaccine is not one that is standardly administered. However, in the more recent years, at least here in California, there have been several really large, significant hepatitis A outbreaks. So this is something that is currently recommended, at least here in this area, and something that I suggest you at least discussing with your provider. Otherwise, making sure that all of your vaccinations are up to date, including tetanus, as well, I think would be important. So in this age group, it's also important to discuss with your provider methods of contraception and family planning in general. So as I mentioned, I've had 4 children. I'm not planning any other children. So this is something to discuss with your provider in terms of what contraceptive methods are good for you and out there. Some are hormonally based, some are not. So there are so many options, and it's a personal decision such that I suggest you discuss it with your provider. For family planning, if you're interested in considering children in the near future, it's also something to discuss. Your provider will make sure that you're healthy to prepare for a pregnancy and give you suggestions regarding that. It's also a great time to start taking a prenatal vitamin as well. But these are all things that someone in our age group should discuss. And the final thing I wanted to talk about is mental health and depression issues. Right now, I'm not having any significant issues with this. However, of course, this is a real concern, especially in the postpartum period for a lot of women. And even if you're not postpartum, mental health is a huge part of a primary care visit. So be sure to discuss these issues that you're having potentially with your provider as well. So those are the 5 areas that I suggest you discuss with your primary care provider at your upcoming annual exam and visit. So I'm a huge proponent of primary practice and primary care prevention. So I really encourage you to continue your annual exams on a regular basis. I'm definitely going to start doing so. I learned a lot from my primary care provider when I discussed these topics with her this week, and I'm hopeful that I'm able to help you as well in planning for your visit. Again, these are just my experiences and my opinions, so I suggest you discuss these in greater detail with your physician, but hopefully it'll provide you some motivation to actually go out there and make that visit. If you have any questions or comments about this video, please leave them below. Otherwise, I'll plan to see you in my next video. Thanks for watching. Bye-bye.